Hi there, I'm Katie Tam. I will be your presenter today, and we are going to be talking a little bit about heart health and knowing your risk for things like heart disease and stroke. But first, I wanted to talk a little bit about some facts that are associated with heart disease and heart health. About every 43 seconds, someone in the United States will suffer from a heart attack. It is actually the #1 cause of death in the United States, and stroke is number 5. And going off of that, about 1 in 4 heart attack and stroke survivors will actually have another. So that's why it's important that we're talking about this today. And I mentioned a little bit about what we would be talking about. So we're going to get into specific risk factors, and then we're going to talk about reducing your personal heart disease and stroke risk. And then we're going to get a little bit more into some age-appropriate testing and signs of a heart attack and a stroke. So I mentioned with the risk factors, there are uncontrollable and controllable, and then contributing risk factors that go with it. So under uncontrollable, we have like age, gender, genetics. We'll get into that a little bit more. And we're going to spend most of our time focusing on the controllable risk factors. So things like tobacco use, diet, nutrition, high blood pressure, high cholesterol, stress management, diabetes, being overweight. So we'll spend most of our time on those factors that we can actually modify versus the ones that we can't do anything about. And I mentioned uncontrollable, so we have age, gender, and genetics. There are, as you get older, those are things that can put you at higher risk. Sometimes it can do with if you're a male or a female. So again, we're not going to be able to do much about those, and we're going to focus more on those controllable risk factors to offset some of our genetics. And as we go along, we're going to get into each specific controllable risk factor. So it will be tobacco use. We'll spend some time on that, and then we'll have a plan of action around tobacco use. So on this particular slide, you can kind of see the order that we're going to go in. So tobacco, high cholesterol, high blood pressure, physical inactivity, obesity, diabetes, stress, and diet and nutrition. So starting off with the tobacco use. The risk that smokers will develop heart disease is much higher than that of non-smokers, so that's why it's really important that we focus on that and we talk a little bit about it. So you can see here that about 33% of deaths from heart disease are actually due to smoking and secondhand smoke. And then the carbon monoxide can increase the amount of cholesterol in our arteries that comes from smoking, and we'll talk about why high cholesterol can be a problem. Nicotine actually raises our blood pressure and our heart rate. So again, that will go along with your cholesterol and your blood pressure. But there are some good things to quitting. A lot of times with coaching, you'll hear people, say, I've been smoking for so long that at this point, why should I quit? Or I'm a little older. Will there be much benefit to quitting? And there are. A lot of things can be short term. So when you do quit, your blood pressure will come down, your heart rate will come down. Then you probably have seen some information about within a year of quitting, that risk for heart disease goes down by about 50%. And it gets better. After about 5 years of quitting, it goes down even further. And I believe at 10 years of quitting is when it goes down to either 80% or it gets back to that normal level playing field of your risk for heart disease going down. So next is cholesterol. I put the guidelines on this particular slide. So that's something that you would get with us as well when we come and coach and screen you guys. We talk a lot about your cholesterol ranges, and we try to flag any of them if they're elevated. So if you have maybe a cholesterol level, a total cholesterol level above 200, if your triglycerides are above 150 or your LDL is above 130, that's something that we kind of work with you a little bit to get that number back down, because when you have those high cholesterol levels, it builds up plaque in your arteries, and it starts to make your arteries inflexible. And that's where a heart attack or a stroke could happen, when there is a blockage in your arteries. So that's why we want to watch for those high cholesterol levels and try to bring them down as much as we can to bring that risk down for your heart. And the one that I didn't mention is your HDL. That's one that we want to be high. So if you hear us talking to you during your coaching appointments and we're telling you this number needs to be higher, your HDL, it's like a maintenance crew for your arteries. So if we can get that number going up and the other numbers coming down, it's going to be even better for your heart risk. And this next slide, I've talked a little bit about it already. If you have too much cholesterol in your system, that's where, like I said, it builds up, the plaque builds up, and it can make your arteries inflexible. So that's where those blockages can happen and cause some problems with that heart attack or a stroke. Blood pressure guidelines and high blood pressure. So the guidelines here, that was something that was switched back in 2019. It used to be where stage 1 high blood pressure started around 140/90. They've actually made it now where it's 130/80. So that top number is pretty important. So again, this is something that we talk about with you guys during your coaching appointments, especially during that initial appointment where we're getting all of your numbers. And if we flagged you for high blood pressure, it's something that we're probably checking with you each time we see you. And where high blood pressure comes into play, when our heart is, or when we have high blood pressure, our heart is working harder. The functions that we normally do is just working a lot harder than someone that maybe has normal normal blood pressure. So again, that's where that's going to increase your risk of stroke, heart attack, kidney failure, and it's usually dubbed as the silent killer because a lot of times nobody has any idea that their blood pressure is high. And if you're getting symptoms of high blood pressure, that means it's probably really high. So that's why we really want to check it each time we see you. Physical inactivity is another one. So this is one where if you are not moving and you're sedentary, which most of us are, we have sedentary jobs, you're 2 times as likely to develop heart disease. And that can lead to high blood pressure, which we just learned how that can cause problems for our heart. It's working harder, and we're having a hard time performing functions that we should be performing with no issue, really. Being overweight, that can kind of lead to things like high cholesterol, high blood pressure, type 2 diabetes. So it just heightens those other risk factors that we've already talked about. And again, this is something that we talk with you guys during your initial appointment when we get all your numbers. You can see the classification there on the slide about where your weight might fall, but we do talk about this and we work with you guys on this if this is something that we have to work on with you. Diabetes. So again, here are the guidelines. We typically get your guys' blood sugar when we see you in that initial appointment. So if that number is above 100, then it would be considered elevated. And if that's elevated, then we typically run an A1C. So the fasting blood sugar comes from a 12-hour fast, and the A1C is a 3-month average. Usually if your A1C is okay, that's a better indicator of like diabetes risk or heart health risk. Because sometimes that 12-hour fast can be somewhat elevated for some people, so that's why we look at both of those. But the two go hand in hand. People who are over the age of 65 with this particular study, they found that at least 68% of people over the age of 65 with diabetes actually die from some sort of heart disease. So that's a pretty big number. And only about 16% die of stroke, which is still significant. So there is a correlation there between the two. So stress, this is one of those contributing factors. And really, studies show that there is a relationship between heart disease risk and a stress in a person's life. But it's really more so the fact that when we're stressed, our behaviors are not necessarily the greatest. So maybe we're overeating, we're not eating great food, maybe we're not exercising as much. Some people will turn to drinking alcohol or smoking more cigarettes. So it's really more dependent on the fact that we're just not taking care of ourselves in times of stress. But there's also a physiological side of this as well. And think of this more of like the fight or flight, and if we're chronically stressed, then we're having problems with, increased heart rate over a long period of time. Their blood pressure is a little bit higher. Our added energy during that time will actually release extra cholesterol and fatty acids into your bloodstream. So that's where that high cholesterol can come into play when you're stressed out. And then we're also having increased and continued release of cortisol, which again will increase the amount of fatty acids in our body. So you can see how the physiological effects of stress over a long period of time can cause a problem for our heart. Diet and nutrition. So this is one where, again, it's just a contributing factor, but if we are consistently intaking foods such as saturated fat, trans fat, added sugar, sodium, those things can all lead to high cholesterol, high blood pressure, being overweight, diabetes. So it makes a big play into those major ones that we've talked about already. So where can you find saturated fats, trans fats, sodium, added sugar? So it's going to be in things like sweets, pop, energy drinks, cakes, cookies, commercially baked goods, fast foods, fried foods, red meats, full fat dairy. So while you can have those things, it's just if you're consistently intaking them at high amounts, that's when it becomes a problem. So alcohol use, drinking too much alcohol, and I guess too much would, you can see the recommendation at the bottom of the slide. It's 2 drinks a day for men and 1 drink a day for women. So if you're consistently intaking more than that every day or throughout the week, then that can pose a problem, and it can start to raise blood pressure. It can increase your risk for stroke, cancer. It can definitely increase your triglycerides, start causing irregular heartbeats. It can contribute to obesity. So you can see there how some of those things we've talked about can increase that risk for heart disease. And when I've done this presentation before, people have asked, can I save all my drinks until the weekend? Not necessarily, that's not a good idea either. So just wanted to clarify that for someone that may be thinking that as well. So let's talk a little bit about reducing that personal heart disease risk. And again, we'll kind of go through, we'll start with the tobacco here and develop a plan for each one that we've discussed already. So with nicotine use or tobacco cessation, that's, I mentioned earlier, the single most important thing to eliminate if we can, because it's just a huge issue for heart health. So to be successful, it takes a lot for someone to quit smoking. It usually takes somewhere between 7 to 11 attempts to quit. And usually having some additional support any way that you can is the most beneficial route. So talking with a PCP, talking with them about what type of nicotine replacement therapy would be good. Some people have done it cold turkey and it's worked for them, but typically having some type of aid is more beneficial, so you're not feeling the effects of withdrawals. It helps you step down from it. It helps you feel more confident with stepping down from quitting. Setting a quit date so you can prepare with getting, an environment ready. You can talk to friends and family. You can have the right tools and things that you need to get ready. You can get support that you need. So those are, quite a few things that you can do, but that first step is probably just talking to a provider about quitting and what options you have to quit and help that. So exercise is another one. Exercise is going to hit on a lot of different ones that we've talked about with like high blood pressure, cholesterol levels, blood sugar levels, obesity. So consistent exercise, if it will lower your blood pressure, it will lower your heart rate, it will actually lower your LDL and your triglycerides, and it's the one thing that will raise your HDL. So we talked about HDL earlier, that's your good cholesterol, and when we have high levels of good cholesterol, it will actually kind of clean out your arteries and help get rid of some of the LDL and the triglycerides in there. It's also going to help you use your blood glucose better for energy. So it's going to lower those glucose levels and help with insulin resistance. And I have a quote on this slide from a study that talks about people who walked at least 2 hours a week were less likely to die of heart disease than their sedentary counterparts. And those who exercise 3 to 4 hours a week cut their risk even more. So something even as simple as walking consistently can make a huge difference for your heart. The recommendations for exercise are 150 minutes of moderate activity per week. And that could be, roughly 30 minutes, 5 days a week. Moderate activity could mean just like if you did a talk test, you don't want to be able to talk easily, but you also don't want to be exercising so hard you can barely do a sentence. So somewhere in the middle there, it will be different for everyone. Strength training each major muscle group 2 to 3 times a week, and then some flexibility exercises. And I should say, if you aren't doing anything, then trying to get those recommendations in right from the beginning is probably not the best bet. You can start anywhere. So even if it's 5-10 minutes a day, and then building up to that 30 minutes, 5 days a week, that's a good route to go. And walking is one of the, like I said, the easiest, most of the time free when it's nice outside, thing that you can do to get that exercise going. So diet and nutrition is another one. On this slide, you can see that there's choosemyplate.gov, and that's the main thing we're going to focus on with your diet. I know there's a lot of different things out there as far as what people do, but as far as like a heart healthy type of diet, focusing on a balanced, varied diet. And then there's also a picture up there of the American Heart Association certified label. You can find that on certain food products, so that's a good indication that it would be a heart healthy choice for food. And when I say balanced and varied diet, we're going to focus on, fruits and vegetables, whole grains, healthy fats, and lean proteins. Something that's low in added sugar, low in sodium, especially for blood pressure. If you have high blood pressure, it's recommended to do 1,500 milligrams of sodium a day or less, which is about 1,000 milligrams less than the general population. So that's what we'll be mainly focusing on here. So we'll start with fruits and vegetables, and really any type of fruit and vegetable is okay, fresh, frozen, canned. If you're doing canned, making sure that it is, lower sodium, or you can rinse it with water. If you're doing frozen, making sure that it's not covered in a lot of sauce or like a cheese sauce or anything like that. With fruit, making sure it's packed in water versus heavy syrup or light syrup or in its own juice. You could do that even. So really not a lot of, you could choose whatever you want here, whatever you enjoy, and finding any way that you can get them in a meal. So you could do some with breakfast. Maybe you can top it like your oatmeal, or add veggies to your omelet. Whatever you like and however you can get them in. And eating a varied, colorful diet of them is good as well. And then fiber. So fiber is good for cleaning out your arteries, and it also helps with blood glucose levels. It can help with appetite control. So right there, it's going to help with cholesterol levels, diabetes, and even being overweight. So you can find fiber in things like whole grains, fruit and vegetables that we've already mentioned. So on the slide there, you can see some good options, and there are many, many options out there. I've just listed a few, but if you can find things like 100% whole wheat bread, 100% whole grain bread. There's wheat pasta now. There's whole wheat pancakes, waffles, things like brown rice, quinoa, barley, oatmeal. You can do high fiber cereal. So really anything that is a whole grain or a whole wheat product would be good. It's the refined flours that can start messing with things like your cholesterol levels and your glucose levels. So you're gonna find that in the white refined flour, white bread products, white rice, sweetened like foods, cakes, pies, candy, things like that. So if you can make that switch, that's really important. Healthy fats. So healthy fats can actually reduce your LDL and your triglycerides, and some of them can improve your HDL. So there's different types of healthy fats, like monounsaturated and polyunsaturated fats, and then omega-3 fatty acids. So you're really gonna find those in things like fish, nuts, seeds, peanut butter, or any type of nut butter really, avocados, olive oil, olives. So those things, like I said, will help with lowering your LDL and triglycerides. And not only that, they're going to help you feel satisfied. So that can help with things like appetite control and obesity as well. And then stress, that's a huge one. Just trying to find any way to manage it. On this particular slide, there's different ideas, but it's really whatever you can do consistently that will help with managing stress. And you know, it can be something as simple as just getting enough sleep, getting outside in nature. It could be reading a book. It could be, you know, writing in a journal, or it could go on the opposite end of that, of maybe you need to talk to someone like a therapist or a doctor about getting some extra help. It could be, you know, prioritizing your time better, so time management skills. So really anything that you feel like is going to be helpful. On this slide, there's just some additional ideas. Sometimes people just need things that they enjoy. So it could be a hobby, it could be an instrument, it could be, you know, going and hanging out with friends. Really, it's just anything you can do to reduce that stress or mitigate it in any way. And then working with your doctor. So it's really important that you are talking to them about these things. We're going to get into some age-appropriate testing here in a second, but make sure you're getting your physical. You know, that time with us where we do your health screen shouldn't replace a physical. You should still go in and talk to your doctor about things. You know, if you're on a medication for any of the stuff that we mentioned today, make sure that you're being compliant with that medication. You know, getting the preventative tests done that we're getting ready to talk about, and then monitoring blood sugar and blood pressure if you're supposed to be monitoring it. So age-appropriate testing, blood pressure, that's something that they're going to do every time that they see you. It's something that we can do quarterly when we see you. So that's definitely something just with us, you're probably getting done as much as you need to be getting it done, unless you are on blood pressure meds or have high blood pressure. The lipids, so that's your cholesterol, getting that done at least every 4 to 6 years, starting at the age of 20, more often if you have risk factors. So again, if you are in our program, that's something that we do yearly, so you're getting that done quite a bit. And if you have high cholesterol, then we're testing that quarterly. So definitely something that we're hitting with you, but not a bad idea to get done at your provider if you need to get it done. At the age of 40, your PCP should calculate a 10-year risk of heart disease or stroke. So that's something, if you've never had that done, you can talk to your PCP about as well. Weight and BMI is another one. We calculate that every year. That's something that they do at every visit. So that's definitely something that we've covered with you. You can do waist circumference as needed. We don't necessarily do that. I'm not sure that doctors do that as much anymore, but it's something that you could ask them to do if your BMI is greater than 25. And then the blood glucose test. So that's every 3 years beginning at the age of 45. And if you're diabetic, your A1C should be done twice a year. So that's something that we definitely do with you yearly. And if you are diabetic, obviously you're going to those appointments and getting those done. So we are covering most of those age-appropriate tests with you, but if we are flagging it as higher, then that's something you can go to your doctor about. And then the last part here is heart attack and stroke, signs of those. So a heart attack, I should say, is when there's a blocked artery that supplies blood to the heart that can lead to a heart attack. A stroke is a blocked artery that supplies blood to the brain. So that's the difference between the two. And then plaque, that's just when you have an increase of LDL and triglycerides in your arteries, and that can lead to those blockages. So signs of a heart attack, chest discomfort, so uncomfortable pressure, squeezing, maybe there's a fullness or pain. There's discomfort in other areas of your upper body, so maybe there's pain in one or both of your arms, your back, your neck, your jaw, your stomach. You're experiencing some shortness of breath. Some other signs could be a cold sweat, nausea, lightheadedness, vomiting. If you're experiencing any of those, it's very important that you call 911 and get the help that you need. And then stroke signs. So a sudden numbness or weakness of your face, your arm, your leg, and it's on one side of your body only. You have a sudden confusion, trouble speaking, understanding. Maybe there's sudden trouble in seeing in one or both eyes. You're having trouble walking. You have some dizziness, loss of balance or coordination, and there's a severe headache with no cause. So you can kind of see the difference there between the two on the signs of the stroke, because that's the blockage to the brain. You can see how a lot of that is upper body, one side of the body, and you can't talk, walk very well, can't see very well, and you're confused. Again, if you have any of these symptoms, call 911. And then this slide is just an acronym for the stroke signs. It's FAST. So if you have face drooping, arm weakness, your speech is slurred or messed up, then it's time to call 911. If you have any questions, feel free to email me. My email is ktam@logansupportmemorial.org. I have it listed on the first slide as well. But that is all I have for you. Feel free to reach out if you need anything, and thank you.